Hi everyone, welcome to this training on Internet trends in 2015 and what impact this has on your practice. Now, this is an incredible report that's been released by a firm called KPCB, which basically partners with the brightest entrepreneurs. And what they do is they turn disruptive ideas into world-changing businesses. And this firm has actually worked with pioneering companies like Amazon, Google, Nest, Twitter, Uber. And what this firm does is they essentially offer tons and tons and tons of insight in their annual reports as they try and help companies become more successful. Now, when you go to their website, you'll actually find reports from previous years. What I'm going to do in this training is I'm actually going to take their 2015 report, which is actually available on their website. If you click on their website, you can actually access the report and you can download a PDF of this report. So again, you can access this report directly from their website. But what I'm going to do here in this training today is analyze this report and the impact that it has on the growth of your practice. So let's go ahead and get started with the review of this phenomenal report that was published in the end of May 2015. Okay, so I'm going to dig right in and tell you what impact this has to your practice. There's been a significant increase in the number of internet users, from 35 million internet users in 1995 to 2.8 billion internet users in 2014. That is 39% of the world's population. That's incredible. Now, if you thought that was interesting, think about this. From 1995 to 2014, the actual mobile phone use has gone up to a whopping 73% of the population in the world. So 73% of human beings on the planet own cell phones, and 40%, as of the time of the creation of this training in this particular report, 40% use smartphones. Now, you can expect in the coming years that not only is the actual mobile phone use amongst your patients and your clients, not only is that going to increase, not only is that going to go up from 73%, but this 40% smartphone use is actually going to approach 70, 80, 90% in the coming years. Also, looking at internet companies, the difference between 1995 and 2015, you'll see that some companies have simply dominated completely. There was a time when you looked at companies like Netscape, you looked at companies on the left side like web.com, and those companies aren't even in the top 15 today. In fact, quite honestly, I don't even know where those companies are today. So when you look at the right side, you see the lead players, and this will start to give you an idea of how quickly the world is changing, specifically the online world, and I'll tell you how that impacts your practice. But this gives you a broad idea of how things are changing at the high level. And if you look at some of the numbers on the right-hand side, you'll notice complete domination from certain companies. The difference between the company at the bottom, Twitter, and Apple, it's a significant difference, as you can see on the right side. Moving on to additional slides, in the 1970s and the 80s, there was VCR, there was cable, there was AOL, and now we're looking at things like Netflix, we're looking at things like Amazon Prime Instant Video, which I use myself, and Chromecast. So the manner in which people consume content is fundamentally changing, and the manner in which you can reach your patients and your clients is also fundamentally changing. This slide also is telling the impact of the internet has been extraordinary and broad, but in many ways it's just beginning. When you look at this slide, it gives you a bird's eye view of how fundamentally consumer behavior has changed and how significantly it has changed as a direct result of the internet, of the use of mobile phones. And we're going to talk a lot about mobile in the coming slides. So now let's take a look at some of the key internet trends. the growth of the internet is solid, but it's slowing down because, the biggest areas of growth have already happened. The growth of smartphones is also significant, but it's slowing down to some extent. And this graph will actually tell you how the subscription, the total number of mobile subscriptions is increasing. Proportionately, when you look at the yellow zone, you'll see that the smartphone subscriptions are increasing at a much faster pace than total mobile subscriptions. And you look at the use of you look at the users of internet, which is shown in the blue bar here, which is also increasing. But what's really interesting is that the number of smartphone subscriptions are increasing substantially. This is also telling there was a 70% increase in mobile data traffic. In other words, people are doing more and more on their cell phones than they used to do before, which is very interesting. More and more consumers are now starting to consume data on their phone. Now, what does this mean for you? This means that your ability to have mobile-friendly websites, to have a mobile-friendly appointment scheduling experience for your patients, your ability to be on YouTube, your ability to have videos that can be actually seen by patients online from their smartphones is going to be a way for you to actually engage with your patients, because more and more people are now starting to essentially engage with digital media on their cell phones. The old school way of marketing, marketing in a print medium, it's not going anywhere, but definitely, there's definitely an over-indexing of print relative to the actual amount of time spent on print medium. So what this means is you've got to look at trying to reach patients on their cell phones. It could be text messaging patients through through a piece of software like Clinical Contact. It could be sending appointment reminders to patients on their cell phones. It could be engaging with patients on their cell phone, whether you use a software like intouchemr.com. It could be sending email newsletters which patients can view on their cell phones. One way or another, you've got to find ways to engage with patients and to interact with patients directly on their cell phones. In fact, you can probably hear my own cell phone buzzing as I'm conducting this particular training. Just goes to prove the sort of the universal, the ubiquitous presence of mobile technology in our day-to-day lives. Over a period of time, you're also going to start to see advertising on desktops. In other words, Google ads that appear whenever you browse a website. People are doing less and less browsing on their computers and more browsing on their actual mobile devices. It's just the nature of consumer behavior. So you've got to start saying, how can I approach and how can I reach my patients, reach my clients when they're on their cell phone? There are mobile ad networks. But more importantly, you've got to understand that more and more of your patients are spending time on their cell phones. A lot of things are actually indeed changing in the world of advertising, which is why it makes sense to look at some of the new trends. Pinterest, if you're familiar with it, Facebook has recently introduced ads that allow you to browse multiple images. There are 5-second video ads. There's Google local inventory ads. Obviously, the social networks like Twitter, like Facebook have mobile-friendly pages. But, essentially, small screen viewing content on small screens as opposed to larger screens is now becoming more and more prevalent. In fact, the thing that truly fascinates me personally is if you look at this graph right here, people are watching less and less TV, okay? People are spending more and more time on what we call vertical screens. What's a vertical screen? A vertical screen is where you watch a video in a full vertical resolution. What this report suggests that full screen vertical video ads are getting a much higher completion rate compared to horizontal mobile video ads. So, what we need to do is fundamentally reimagine the way we consider reimagine the way we try and reach out to our patients, reimagine the way we reach out to our clients. In fact, speaking of reimagination and this is something we constantly do over at InTouch EMR, is we're constantly trying to reimagine processes that try and make a practice more and more efficient. You've got to change and improve as you evolve. In fact, here's an interesting quote from Twitter that was actually mentioned right in this report. Enterprise software used to be about making existing work more efficient. Now the opportunity for software is to transform the work itself. In fact, we personally at InTouch EMR believe in re-engineering the before, during, and after patient experience. So you can always go on LinkedIn and look for this article on how to re-engineer the before, during, and after patient experience if you want a very clear idea on how an improved process can, transform the way you actually interact with patients and the way you do everything from eligibility verification all the way down to the collection of accounts receivable. So I definitely recommend that you check out this article when you get a chance. So speaking of reimagining consumer behavior, I mean, we've evolved from old school email tools to new type of tools, old school payment systems to new types of payment systems, old school ways to accept and process online payments versus new ways. I mean, here's a simple, there's several tools here that are outlined in this slideshow on, improvements in the way faxes are sent, improvements in the way you can communicate with patients, improvements in the way you can keep track of transactions, have people to accept and receive calls on behalf of your practice. Several different evolutions have happened in the way we traditionally do business, and there are several phenomenal websites that are actually listed here that allow you to streamline what you're doing. This is an interesting quote. 10 years from now, when we look back at how this era of big data evolved, we will be stunned at how uninformed we used to be when we make decisions, by Billy Bosworth, from the CEO of DataStax. So now let's take a look at how you try and reach patients. Speaking of reimagining, how do you reimagine messaging, the way you reach patients? I mean, after all, there have been a lot of improvements, change. You've probably heard of the recent acquisition of the company WhatsApp by Facebook. Fundamentally, consumer behavior is changing. People want instant communication that's fast, that's casual yet professional, and really fast instant communication. The success of applications that are well known on the left, like WhatsApp, Facebook Messenger, and Snapchat, proves this, whereas applications on the right may not be well known, but they are growing very, very, very quickly. So the field of instant messaging is evolving, but it does, at the end of the day, one thing's for sure: people want different ways to be able to communicate with each other. People like instant messaging. The days of text messaging are slowly, over. I personally used to use WhatsApp. I use this application called Viber. So basically, the manner in which consumers are interacting with each other on their cell phones, and even perhaps with your practice, is constantly evolving. You need to think of communication with your patients not just as a one-way communication where you send a message to a patient and then the message, then the patient interacts with you, but you've got to think of what I call communication hubs, where patients are not only getting messages from you, sending messages back to you, but also interacting with each other. And the emergence of devices like the Apple Watch. There'll be other devices by the time you watch this. That just goes to show that people want communication. We live in an age where it's becoming easier to communicate through technology, and that's the way you've got to modify your messaging. Perhaps have your own WhatsApp group, have your own Viber group that patients can be a part of. Perhaps make your clinic or make someone in your clinic accessible through WhatsApp and Viber. Think about that, especially if you're in an area where patients use mobile phone technology and mobile phone communication mediums a lot. Now let's think about content for a second. Now you're always, looking to put new content out there, whether it's using a done-for-you email newsletter system like Therapy Newsletter, or whether you're trying to, create the content yourself. The fact is, when users generate content, when patients themselves contribute to the creation of content, whether it's posting pictures on your Facebook wall or whether it's writing comments on articles on your website, at the end of the day you want patients to participate in their own community. I mean, have your own private Facebook group for your patients. Have a Facebook group for your clinic where patients are able to interact with you and your patients, where patients are able to do different things with you. I mean, I personally manage a LinkedIn group as well as a Facebook group. And the kind of interactions that happen in that group are just phenomenal. I mean, there's just so much camaraderie, there's so much interaction between the group members. Post videos in the group. The more videos you post, the more engagement you're likely to have, because people love watching videos. Have your own audio content. It's not difficult to set up an audio podcast or some way to actually reach out to patients beyond traditional text. Think about it. The ways you can communicate online are text, video, and audio. So you've got to try and use a combination of all three. You've got to have reviews for your website, whether it's on Google Reviews or on any other review platform. And in the past 12 months, at the time that this report was released, there were 14 million new reviews on Airbnb, which is a website that's basically disrupting the hotel industry. But these were all user-generated reviews. Users need to be able to interact with each other. That's why you having some sort of a mechanism where your patients can not only interact with you, but potentially with each other, forming a closed hub, a community of patients where users generate their own content and are creating their own minute social network with you as the leader. I mean, this could potentially, according to this report, be 12 to 24-year-olds becoming trendsetters. The use of social media is rapidly increasing. We're talking Facebook, Instagram, Snapchat, Twitter. WhatsApp and LinkedIn actually aren't as big, believe it or not, compared to social media networks like Facebook, Instagram, Twitter, which are huge. Now, this is a very telling statistic. 87% of individuals that were surveyed for this particular question said their smartphone never leaves their side. When they wake up in the morning, they reach for their smartphone. People spend more than 2 hours every day using their smartphone, and 60% believe that in the next 5 years, everything will actually be done on mobile devices. So, dedicated cameras. I mean, when was the last time you saw someone with a dedicated camera, unless they were, a dedicated photographer? People are taking pictures, have patients take pictures of themselves when they're with you, when they're at your clinic, post it on their Facebook wall. Have patients, talk about you on social media with their friends and family. Makes a huge difference. Have patients check in when they're at your location. I mean, people are using their cell phones to do every single thing, driving, following events, getting help, getting public transit information. People are using their cell phones for transportation, for food, for delivery, dining, entertainment, groceries, travel. Why can't they use their cell phone to interact with you at your clinic, to get an appointment reminder message from you, to send you a message, to communicate with you? We're not just talking email, we're talking about using any of these social media platforms where the patient is already on. The key here is keep the patient doing something that they're already accustomed to doing, that's already part of their lifestyle. Can the patient communicate with you through, by being a member of your private Facebook group? Can the patient maybe, use other channels like Instagram perhaps to communicate with you? Because more and more patients are starting to use all of these avenues. Now, let's look at consumer spending. Over a period of, a couple of years here, you'll see that consumer spending has stayed fairly, fairly standard. But there's a lot of innovation happening in the three biggest categories, as you can see on the screen: housing, transportation, and food. Now, if you're thinking, okay, what does this have to be? What does this have to do with your practice? Think about this. Healthcare is nowhere in the top three. Now, imagine if a patient, who needs shelter, who drives, who visits a grocery store. Imagine if a patient could interact with you through their cell phone. Imagine if a patient could basically, communicate with you seamlessly right through their cell phone without having to email you, without having to go into the email messaging app, without having to call you, without having to, be on the phone and, wait to provide some information. What if a patient could seamlessly interact with you in a HIPAA compliant manner that allowed a much higher level of engagement with the patient than was previously possible. Imagine what that could do to the level of engagement you have with your patient. Something to think about. Now, what I'm about to tell you now is actually the flip side of the rapid change in the internet. A lot of clinicians are starting to use EMR systems, and for good reason. Hopefully, you're using HIPAA compliant EMR systems that are certified by the ONC, the Office of the National Coordinator. You can, if you haven't looked at it, you may want to consider InTouch EMR, also on the web at intouchemr.com. But cyber attacks are growing in size, complexity, and risk. I mean, you've probably heard of the recent cyber attack on Sony computers, and the fact is 20% of attacks happen, because of insiders. There's a lot of adware, there's a lot of malware that's actually breaching computer systems. That's if you're at, for example, let's say you're at a Starbucks or you're in a hotel. If you're accessing the internet connection of the hotel, your computer your passwords may be stolen by a hacker sitting right next to you without you knowing it. In a situation like this, the EMR vendor won't be able to protect you because the breach happened from your side. So you've got to be really careful. You've got to have you've actually got to have liability insurance in place to protect you from a situation like this. And obviously, if you need more information about that, you can definitely reach out to us. Give us a call at InTouch EMR, and we'll educate you about cyber liability insurance and send you a free video training on how you can stay protected against something like that. But when a breach happens, it's important to take several precautions to, in compliance with HIPAA. But the fact is, if you're extremely careful, you can minimize. You can never completely eliminate a breach, but you can minimize the probability of a breach. So the right knowledge of security is crucial in the interconnected world that we live in. In fact, and this is frightening. In 69% of all breaches, the victim did not detect the attack on their own. They were notified, by third parties, and this is, forcing people to disclose breaches in a manner, that you can't control. So it's a very serious issue. You've got to have a plan in mind to protect your data, even if you're using a third party EMR vendor. In fact, you should talk to your EMR vendor and say, what are you doing to protect my data? You've got to do that. Now, let's take a look at America's evolving work environment. There's, globalization, there's structural changes. I mean, I'm sure a lot of practices listening, it's not uncommon for you to actually have a biller who's working remotely. Why? Because, that's possible. People have changed, jobs have evolved, connectivity has changed, technology allows, people to do things in a much more efficient manner. There's an evolution of systems, of people, of software, of policies to allow for a more connected society. Jobs have evolved, work has evolved. In fact, I envision a practice in the future where, the person who's scheduling the patients doesn't even need to be there. The clinician definitely needs to be there. The biller doesn't need to be there. So the patient walks in, patient's already checked in, the clinician sees the patient, documents the patient, moves on to the next patient. If the patient has any questions about, appointment reminders, about eligibility, they can speak to someone on the phone who doesn't physically need to be there. Think about that for a second. Now, this trend from the Census Bureau is very, very, very interesting. The sources of healthcare insurance from 1999 through 2013, they used to be employer-sponsored, but the employer-sponsored insurance plans are gradually declining. The number of Americans dependent on Medicare, Medicaid, military is steadily increasing, and direct purchase consumers, thanks to the Affordable Care Act, Obamacare, are slightly increasing, but they haven't reached, a mass threshold. One way or another, what you're looking at insurance premiums that, the insurance plans that are structured in such a way that reimbursements rates go down. When you combine this with the general downward trend in reimbursements, which, by the way, is a direct result of, our movement from, a fee-based world to a pay-for-performance world. It's also because, the American government is fundamentally bankrupt. there's trillions of dollars in deficits. So one way or another, they got to save money, and one of the ways of saving money is to reduce Medicare payments. And one way to do that is to justify the reduction in Medicare payments by using, standards like PQRS, the therapy cap, manual medical review, functional limitation G codes, multiple procedure payment reductions, and so on. But what's the bottom line? The downward shift in reimbursements is here to stay. We're like I said, we're moving towards a pay for performance world. And when you look at a trend like this, you know immediately as a practice that you've got to be able to diversify. You cannot spend hundreds of dollars a month on expensive EMR systems. You cannot spend thousands of dollars a month on a marketing person that may or may not work. You've got to use done for you tools. You've got to use done for you systems and coaching and consulting. You can get more information at referralignition.com. You've got to be able to use EMR systems that are affordable, that are HIPAA compliant, that are Medicare compliant, that are less expensive, and that integrate all the aspects of marketing so that you can have less expensive, more reliable, more automated systems. And the trend is here. You can either diversify your practice and increase revenue and streamline and automate your systems, or you can just continue doing things the way you are and, quite frankly, slowly go out of business, because over a period of time, if you're dependent on payer reimbursements, you'll see that the proportion of patients that have Medicaid, Medicare, and military are actually increasing, and patients now have insurance plans that pay less and less, and that is a general trend. Now, as you think about this, I want you to examine a very fundamental trend, and that fundamental trend is that people have also changed. Some of these graphs show you the trends that have been happening, in the country, the trends that have been happening that sort of, that are interesting. But this is an interesting one. The size of the average household in the last 100 years has actually gone down. In other words, the average household in the United States has between 2 and 3 people. So what that means is that the households are actually getting smaller, and this is the most telling statistic of all. Although the percentage of populations, the percentage of boomers in the workforce is reduced, the percentage of millennials, people born right around the millennium, people aged anywhere from 15 to 35, this is steadily increasing, and it's substantially increasing. What this means is a 15 to 35-year-old patient who is working, who has the spending power to be able to take advantage of your services, what can you do to provide additional value to this patient? Can it be a massage? Can it be weight loss program? Can it be a fitness program? Can it be a stress management program? What can you do to diversify your revenue, provide more value to this patient? Because these individuals do have the spending power. We're talking of 15 to 35-year-olds that can make decisions about what they should be doing with their money, that are likely to spend that money, provided they are made to see the value in what you have to offer. Very significant. Now, I talk about people changing. So the next logical question to ask is, okay, how are employees changing? Well, here's how employees are changing. More and more people want training and development. They want to improve as members of the workforce. They want to become more efficient. They want training, they want development. People want flexible working hours because people want to be able to pursue the kind of interest that they have, whether it's a family, whether it's a personal life. And this actually matters to individuals a lot more than cash bonuses. I find that extremely telling, more so than cash bonuses and free private health care, because now, with the Affordable Care Act, people can buy their own inexpensive health care. So again, what's interesting is training and development and flexible working hours, and obviously that's followed by cash bonuses. But again, it goes to show you how employee behavior is also fundamentally changing in the coming years. So what do these millennials expect at work? Many expect to be mobile. They expect to be able to work from home, office, cafes. Some of them like to work outside of business hours. People want to make their own flexible schedule. they're also extremely tech savvy. Now, these are the individuals that are driving the growth of technology like WhatsApp, like Facebook, like Instagram, like Snapchat. These are individuals that are using more and more cell phones, more and more smartphones. And these are the individuals who actually, use software, who like systems that are streamlined, that allow, more control, like online appointment scheduling, exchange of data with the practice, all of which, by the way, is possible with applications like InTouch EMR. These are the kind of patients that have the spending power, because they're more tech savvy, they're more flexible, they're more likely to be buyers. They're also more likely to be workers at your clinic, which again is a fascinating trend when you look at the general trends that have been happening across America. So now let's take a closer look at millennials and identify what we can refer to as on-demand workers. Millennials can be on-demand workers. In other words, these are the kind of workers that are more flexible, that are available at a moment's notice, literally, to be able to work for you. Now, it's important to analyze and talk a little bit about these millennials because fundamentally, and this is the source for this particular slide is a 2015 Millennial Majority Workforce report from a company called Upwork, which previously used to be Elance Odesk. These sort of on-demand workers, or staff members, if you will, tend to be the most flexible of all. They tend to be creative. They tend to be open to change. To some extent, they tend to be narcissistic. One thing they're not is, team players. So, which is interesting because, there's a very strong sense of individuality amongst, the new employee, if you will. Like I said, narcissistic, open to change, creative, definitely money driven, but very adaptable. A very different mindset. From the workers in the economies we're used to. Now, managers ultimately have a disconnect in terms of the needs of what these millennials want. A manager assumes that what a millennial wants is high pay. What's useful and what's good to know is that millennials want meaningful work more than anything else. So there's a fundamental disconnect between a manager or an employer and the manager understanding the needs of these youngish millennial staff members. I mean, if you're hiring a front desk person or a billing person, or if you're hiring, a clinician, and they happen to be millennials, then some of these lessons should help you understand what they want, what drives them, and help you to manage them much better. Now, as you can probably guess, the percentage of population, the world's population with internet access is increasing substantially. There's more and more people who now have cell phones. E-commerce is growing very rapidly. Alibaba, which is a China-based company, is growing very quickly because it connects wholesalers with suppliers. It's basically disrupting the traditional distribution chain model. And consumers want ease and consumers want speed, which again, helps you, which explains why these flexible jobs with these millennial workers are growing so quickly. I mean, if you want someone to be a front desk person at your practice, if you want someone to be an assistant or an aide, chances are you can find such a person very, very, very easily. And chances are, if you position yourself correctly, and if you use the right ad and the right, medium, and, we can teach you this through the Hiring RX program, which is a part of the Referral Ignition training program. You can get more information at referralignition.com, but we can teach you how to attract the right people to your practice and and therefore grow your practice, because fundamentally more people are working in flexible and supplemental jobs. And free, and as far as categories of freelancers are concerned, there's different categories of people who are really doing multiple jobs, and a lot of these people find out about you, make judgments about your practice, even make comments about your practice and your work environment on social media. The internet has allowed these people to easily find work, and there's several different websites available where you can easily earn an income online. But at the end of the day, people want to make money on their own terms. They want to find ways to earn extra income. There are a lot of different websites where people can earn additional income and where people actually use multiple platforms. Now, in a nutshell, this sort of covers the entire slideshow as it pertains to your practice. But I do want you to understand that, with the change in the internet, with the emergence of online platforms and marketplaces, there's a fundamental change in consumer behavior. There's a fundamental change in employee behavior. I would go so far as to say that the sense of loyalty that we expect from patients, a sense of loyalty we expect from staff members is going to be hard to find. Why? Because the world is so interconnected. It's not difficult for someone to, jump ship quickly, whether it's a patient going to a competitor who managed to market to them on Facebook, or whether it's a staff member who's going to quit simply because they can go work for the clinic down the street, who managed to solicit them on LinkedIn. I mean, at the end of the day, it's never been more important. Now is the time actually to create more meaning in your work, to find new ways to use some of these trends to connect better with patients and staff members. Because at the end of the day, the benefits, you have the ability to reach your patients and your staff members in ways that were never before possible. You can call them, you can text them, you can email them, you can WhatsApp them, you can Viber them, you can form a close Facebook group. You can do so much. You can save a lot of time. I mean, if someone can't come into work today, they can work from home. If you're using a web-based EMR scheduling and documentation system. Obviously, clinicians can't do that because that's something that you never want technology to meddle with. There's more transparency. It's very obvious, who's working, who's not, how much work they did. There's a significant level of personalization. There's ways. I mean, if patients like you, they'll write reviews about you. Those reviews are there for the whole world to see. On the other hand, there are challenges. All this flexibility comes with, a trade-off in quality, a trade-off in trust, a trade-off in time and convenience. So there's just, so many things that need to be considered. Benefits include, the ability for staff members to make more money, the ability for you to make more money if you can demonstrate, the right skill set match with what your patients want, communicate effectively, use data, identify segments of patients and grow your practice. There's the other hand. On the other hand, like I said, there's always there's no complacency is a big danger in the new economy. Don't think that even if you are successful, I don't want you to think you're successful. The incumbent displacement is easy. I mean, Microsoft used to be the number one company in the world. Now it's Apple. When Apple almost went bankrupt, there was a time when Apple was on the verge of bankruptcy. Anything that's, if you're at the top today, you may not be at the top tomorrow. There's financial uncertainty. There's a lack of loyalty, if you will, for amongst patients and amongst staff members. I mean, a culture, a vision these are all words that we use to justify our own sort of logical, words that we use to justify logically what's going, our culture, our vision. But the fact is, in an interconnected world, culture and vision is sort of much harder, way, way harder to actually control. So, as we head into a new world, I mean, you're going to see essentially, you're going to see a clash, if you will, between the incumbents, the companies that lead the way, your competitors. If your competitors dominate, that's okay. On the other hand, there'll be innovators like you who take advantage of these new trends to reach more patients, to better serve existing patients, to create new markets for yourself, to hire better employees and to hire them, to train them, to motivate them and to retain them. And on the other hand, there'll be regulators. Because as we're heading into a world where more and more patients and more people get interconnected, guess what? More and more of our data is out there, is vulnerable to hackers, is vulnerable to malicious elements, is vulnerable to employees who may be up to no good if they feel scorned. So you've got to be really careful about the protection of your data as well. So at the end of the day, there is a significant opportunity. There's also a significant chance for you to displace the incumbent, to displace the leader in your area. You've got to look over your shoulder and constantly, be aware of regulators. And on the other hand, you've got to continue to be an innovator. Okay, everyone. So I hope you had a fantastic time on this training. I really, really, really appreciate you being here, and I hope you got a lot out of this. Now, I have a special announcement for everyone who's attended this training. I'm conducting a special event in October in San Diego where I'm going to teach you everything that you learned in this training and a whole lot more. Now, when this event goes on sale, which is going to be available, tickets are going to be available shortly. The tickets for this event are going to range from $299 for this 3-day event for a single attendee, all the way up to $499 for 3 attendees. For those who've attended this special training, because you've put in the time to attend this entire training, I'd like to offer you a 50% discount. That is a 50% discount if you make a decision to attend the training in the next 2 days. So you can take 2 days to think about it. You can actually go to the website at referralignition.com/event. Take a look at all the presenters we have. We have a whole bunch of presenters, some amazing, incredible presenters, the whole schedules available, the location of the event. It's actually at the Hilton San Diego. In San Diego, like I said, it's on the 16th, 17th, and the 18th of October. And you definitely want to try and be there, because this is going to be one of the most incredible events you'll ever attend to grow your practice. So I hope you can make it. Like I said, there is a 50% discount, okay? Half off of the price of the event tickets if you decide to attend the event and you make a decision in the next 2 days. Just enter the event code IGNITION. That's IGNITION when you register. So all you'll do is you'll click on register. You will move on to the next page to purchase your tickets, and just enter the coupon code IGNITION. That's IGNITION, IGNITION, and you'll get a 50% discount for your tickets. Thank you so much, and I hope this training was beneficial. Don't forget, go to referralignition.com/event, enter the coupon code IGNITION, and I'll see you in the training.